Hello, my name is Bill Rittman and I'm the Chief Technology Officer of Neurotherm International. In March 2008, Neurotherm sponsored a masterclass which brought together a world-recognized faculty to discuss the treatment options for chronic pain. A major focus of this meeting was the challenges in the treatment of SI joint pain. In collaboration with Dr. Brad Willems and with input from leading pain experts from around the world, Neurotherm is excited to introduce the new Simplicity system, designed to quickly and efficiently ablate the sacral nerves that are associated with SI pain. Next, we'd like to show you the cadaveric placement of the Simplicity probe by Dr. Willems.
Let's start with what we would do. So let's see an AP. So we're going to oblique just a little bit, get a true AP view. Okay, and center your target, which we have, pretty much vertical. Patient's body is, you know, in their standard prone, pillow underneath the abdomen. Because of the way, as we talked about, the sacrum curves away from you, we're already kind of in a line. I've tried a pillar view. I might go back to it, but this is what I found works the best. Do we have a laser pointer? No? If not, then we'll just, I'll use this so it won't hurt anything. So, excuse me, John. Sure. If you look down, it's usually across from S4. So if this is 1, 2, 3, 4, it's amazing we can actually see it. You can see where the sacrum's coming up here. So I'm going to touch bone right here. Okay, so I'm going to start down a little bit lower, touch bone here, and then start wiggling along. Here's my sacral line, or the foraminal line. Remember, I don't have to see the dorsal foramen with this. I just have to know where they are. And then, or the foraminal line is, and then wiggle along underneath the ilium, following the line of the joint until I bury it in the wing of the ala. Okay? So, to do the whole case, I numb up their skin, so let's find a spot here. Okay, so we're going to start a little bit more lateral than that, right about there. So I'm going to numb up the skin, and then take a 20... I use just a 25 gauge hypodermic, and then I'll go to a 25 gauge spinal, 3.5 inch. So now I'm on bone, so I'm going to go down. Where's the base of the sacrum here? It's right there. Okay, so now I'm going to put the, I could, and I'm going to put a little bend in this. Okay, so trying to numb them up. Okay, so I'm on bone. I'm running this along as much as I can to try to numb up the track where I'm going to go. Okay, so now that's likely as far as I'm going to go up the joint with a 25. It just doesn't have any stiffness to really drive it. Put your local anesthetic syringe in, infiltrate as you back up. Okay, then I'll come medial. And kind of like if you have to go to plan B to get into an SI joint, again, when you're in ligament, it won't inject, and so then you have to pull back, and hopefully it gets numb. About 30% of the time, I'm actually able to do that, and the patients are pretty comfortable. Other times, they need narcotics afterwards, and to make them more comfortable in the recovery.
Compared to where you tested bone, same place.
Same place. Yep. It's now going through that skin mark. So we're going to come down. And John had suggested leave the 25 gauge needle there because you know where the bone is. And I think that's a great idea. So I'm on periosteum right there. Okay. So now what I'm going to do, I can't obviously drive it because it's curving down. Thanks, John. But I'm just watch this marker with the tape. I'm not turning it a lot unless I have to, but I want to get it to start to move along this line. So I'm just twisting it back and forth to see if I can get this to advance. So I stay in that line, but also stay in contact with the periosteum of the sacrum. Okay, so now we're advancing up a little bit further. You can see I rotated it the other way. So I'm just simply wiggling this along now. And when you get it in this plane with this trocar tip, it goes so easily compared to the other one. I actually thought I had gotten too shallow with it. But now we're coming along again. I want to torque it down, make sure I'm on bone, so I put a little bend in it, just like we do with other needles, so I can get it to dive back down, touch periosteum. All right, now we're going to go medial. Okay, now I'm going to turn it lateral. And once you're here, then it should go pretty easily until it just dives into the ala. Okay?
You're under the alien there, aren't you?
Uh-huh. Yep. I should be. We'll look on the lateral and make sure that we are. So now, let's first go to a square 5-1 now.
Can you put a little marker on the handle as where the
It will have the Neurotherm name on it, so you know which way it curved.
curve?
And see if I did this right. So drop down a little bit. This is so easy. Okay. And let's get a true lateral here, so let's see which way we need to go. Okay, let's split. I'll come back right there. And let's get a penetrated view.
Top of the disc. You don't want to be at.
No, that's right where you want to be.
Now that we've seen the placement of the Simplicity probe, I'd like to demonstrate the operation of the NT1100 RF system, which is required for the use with the Simplicity probe. When the NT1100 is powered on, the welcome screen is entered. The welcome screen gives you several options, including the ability to enter patient data, the ability to enter doctor preferences, and other options such as setting electrical parameters or the time and date. Upon hitting accept, the procedure settings screen is entered. The procedure settings screen allows you to choose what type of procedure you'll actually be doing. By pressing the electrode button here, you can see that there are many options. You can choose single, double, triple, dual electrode, but today I'm going to be focusing on the last two, which are specific to the Simplicity electrode, Simplicity 3 and Simplicity 2. In order to connect up the Simplicity probe, you simply take the interconnection cable, which is labeled 1, 2, and 3, and plug it into the associated 1, 2, and 3 inputs of the NT1100 system. The other end of the cable has a gray connector. This gray connector goes into the Simplicity probe, which has now been correctly placed under fluoroscopy into the patient. The gray connector is simply placed up to the Simplicity probe and rotated until the keys align. A light push then locks the cable into the Simplicity probe with an audible click. Now that the probe is connected, we can see that there are 3 temperatures being measured on the NT1100. These 3 temperatures correspond to the 3 active areas on the Simplicity probe: the distal probe, the medial probe, and the proximal probe. I'm now going to do a simulation of an ablation using the Simplicity system. Here I have an electrosurgical grounding pad, which you need for any type of RF procedure and is typically placed on the patient's calf. On this, I've placed a piece of chicken onto which I will place the Simplicity probe. In order for us to be able to actually visualize the ablation happening, I'm going to place this piece of plastic, which will act as a window during the ablation process. So now that I have my simulation completely set up, it's really very easy to operate the Simplicity system. You simply press auto start and the NT1100 will go through a 5-phase process where it will ablate first between probes 1 and 2, next between probes 2 and 3, then probe 1 alone, then probe 2 alone, and then probe 3 alone. Each of these ablations are going to be made at 80 degrees for 1 minute, although the clinician could choose any other temperature of their preference or any other time. So let's get started. Here we can see the ablation beginning to form between probes 1 and 2. This is reflected on the screen by probes 1 and 2 heating. You'll notice one of them is 82, which is 80 degrees. The other one is a little bit lower, but that's not of any significance. We always make sure that the hottest one is maintained at 80 degrees. Phase 1 is now completed. Phase 2 is an ablation between number 2 probe and number 3 probe, which you can see here. Again, we're maintaining our electrodes at temperatures close to 80 degrees, but now it's number 2 probe and number 3 probe as opposed to number 1 probe and number 2 probe. Phase 2 is now completed. As you can see, these 2 ablations have formed a dumbbell shape on the probe itself. So our next 3 phases are going to fill in those gaps so that we end up with a very uniform, elliptically shaped ablation. First we'll do probe 1 alone, and as you can see, probe 1 will start to fill in. On the screen, only probe 1 is active, and you can see the temperature is being maintained at 80 degrees for 1 minute. Phase 3 has now completed. Phase 4 is going to be a single ablation on the middle probe, so you'll see this concave area fill out as it did with probe 1. Again, 80 degrees for 1 minute, but this time it's probe 2. Phase 4 is now completed, and we're on the final phase, which is isolated probe 3. Probe 3 is this one, and you'll start to see the ablation forming around the probe. And again, probe 3 heating at 80 degrees for 1 minute. At the completion of this phase, the treatment will be complete. The treatment is now complete. Since each phase was a 1-minute treatment, the total treatment time was 5 minutes. You can see here that we have a very uniform, elliptically shaped ablation that is of significant diameter and depth. You've now seen the placement of the Simplicity probe by the developer, Dr. Brad Willems. You've also seen the operation of the NT1100 and the interconnection to the Simplicity probe, as well as a simulated ablation which shows the capability of this system. We're confident that you will find this treatment to be superior to any that are currently available on the market. If you have any further questions or would like to arrange a demonstration, please contact us either at Neurotherm headquarters or contact your local Neurotherm representative.